Hi, CCIH members, Happy New Year. Welcome to year 2 of the 30 by 30 Health System Strengthening Initiative, where we hope to strengthen 30 faith-based health systems by 2030. This is year 2. We learned a lot in year 1, including how to make our application process even better. So this video is to help you fill out your application in a way that is hopefully not as difficult and reduces your stress. One big change is that our application will happen in 2 parts. So part 1 is completing a form online, which I'm going to walk you through, and part 2 will be a virtual conversation once you submit your form with someone from CCIH to help us understand your commitment and how we can help ensure that it is rich and meaningful and understood, and that we share it in the best way possible. So when you open up the form to complete, you'll have some information about 30 by 30. It will have a few links, and then we'll start collecting basic information. So you'll see that I typed in my email and I press next, and I'm just gonna do my name. I'm gonna ABC. I'm just gonna make stuff up to get this. And then it's gonna talk about the commitment areas, access to essential medicines and supplies, financing, health information systems, health workforce, leadership and governance, service delivery, and community services. So it will be really good for you to think about before you make your commitment, what area that you are most interested in making your commitment in. So once you've thought about that, you'll click next, and each commitment area will have a section. So say they're in alphabetical order. So the first section is access to essential medicines and supplies. And if this is the commitment area that you want to make, you would say my commitment addresses yes or no. And if it's no, you would just keep going and you skip ahead and you go to next. Now the next area is financing. So say my commitment is for financing. You could say yes, you could say no. I'm just going to show you that you can keep skipping ahead. So the next section is health information systems. Once again, yes or no, and you can decide, and you can skip the questions. Each area has 6 questions. So the next one is health workforce. So I'm going to pause here. I'm going to say my commitment has to do with health workforce. I'm going to say yes. What is my commitment to health workforce? It is to strengthen the community health workers in my catchment area to be trained in CCIH. I'm going to be very broad right now, but I'd like you to think about more difficulty by 2025. And maybe you want to target 25 CHWs. I'm just making something up right now. Now, each section has indicators that we'd like you to think about. This is part of our monitoring, evaluation, and learning process. So we have a document that has a list of indicators under each section, and I'll show you that in a minute. And so here are some that you could choose. So how are you going to actually track what you've done? You could say, I'm going to track the number of trainings completed, number of individuals trained. You can choose which ones. We'd like you to choose 1 to 3. And then your timeline. So you could say, this might be something you're already doing. So you could say this started in June of 2020, and it's going to go through June of 2025. You tell us what the time area is, or you could say it's just 1 year and you just put the year. And then area. Do you work in more than one country? Do you work in one specific country? Do you work in one specific area of a country? So I live in Kenya right now. The picture behind me is of the Rift Valley. So I might say, where do I want to be working? I'm going to say Nakuru, Kenya. That could be wrong. Who knows? It's up to you guys. And then the last question we have is this focused on clinical services at a health facility or community orientated, or both? So because I'm working with community health workers in my commitment, that might involve health facility staff helping train them, and then helping with support supervision with their work in the community. So I'm going to say my commitment has something to do with both. And then I'm going to click next, and it's going to show the next area, leadership and governance. Maybe there's a part of my commitment about health workers that also addresses the importance of building up the leadership and governance of health facility staff. I don't know. It's up to you to decide how many areas you want your commitment to be in. We just really encourage you to be focused and specific. Another commitment is service delivery. You can decide, once again, yes or no. And then organizational learning. Here's another commitment, yes or no. I'm going to click next. Community services, yes or no. And then at the very end, we just put a little bit about our data security and protection assurance. And we ask you to say, because we want to talk to you, what time zone are you in? Is there a best day or week? And then you can submit. Oh, I'm just going to answer this right now. I am in East Africa time. Let's see. And then you'll get a confirmation to know that your commitment was submitted. Now, if you go to our website, if you're on the form for making your commitment, there's a section on our website under resources for the 30 by 30 Health Systems Initiative. And here you'll find links to all sorts of documents. You can find the commitment makers from round 1 from last year and what they made commitments about if you want to read all those different commitment makers from different countries, different focus areas, just to get an idea of what other people have done. You can find the list of indicators under each health system pillar, contact information, webinars that we've done with some of our commitment makers. There's a lot of different information. So we encourage you to look on our website. And I just really want to say we're excited. We want you to be able to ask questions. There's a sample application on the website. And we really look forward to working with you and walking with you on this journey to strengthen faith-based health systems. So we look forward to seeing what your commitments are and look forward to having conversations. Thank you for your interest. We're so excited to work with you. Bye.